Hi, I'm Dr. Roy. Thanks for joining me. Just wanted to have a few words with you before you make your choice about where it is you go for your anti-aging, functional medicine, and regenerative care. We've done a lot of things here at this practice to try to make it easier for you to not only interact with us and your medical record, but also to achieve the best care and the best results possible. So I want to just talk to you a little bit about our model. We have a whole team that is not located in our office. Their sole purpose is to communicate with you to make sure that you have the information that you need to move forward. They also call you after an appointment to schedule any labs that we've requested and to make sure that those labs are done for your next appointment. So again, you can have an efficient visit where you get what you need. They also help manage pharmacy. So for instance, to keep your pharmacy on auto reorder. When we get started and we prescribe you some medications, it works out really well if we can place you on an automatic reorder with one of our partner pharmacies. This way you get your medication on time. You don't even have to think about it. We use these partner pharmacies as often as possible because of the quality. We know that the quality is excellent, and we know that the customer service is also there, and we can communicate with them on your behalf to make sure that you're not missing any dates, any doses rather, sorry. So you've called the team outside of the office already. That's how you actually are getting this video. And the next move would be for you to decide that you want to engage with us. You would call back, or we'll reach back out to you, and we schedule an initial consultation. Also, we order labs so that you have all of your labs complete by the time you see us for the first time. This works out really well because that way we can start treating. We see your general state of wellness from blood work as well as very accurate hormone levels, and we can start treating. Quite often we'll recommend lifestyle changes as well as targeted supplementation, as well as bioidentical hormone therapy right in the first visit. And when we bring you back in 6-8 weeks, you're already feeling significantly better. So we can really do a lot of treating right at that first visit. So that's important. Wanted to tell you a little bit about the model inside the office. So you know about the team outside the office that's helping to support your care. Inside the office, you're going to have a medical team that consists of a physician, a physician's assistant who is a fully trained, very experienced practititioner. They write prescriptions, they make medical decisions. So you actually have two licensed medical professionals on your team looking at your wellness and combining ideas so that we can take really very good care of you. You also have a medical assistant on your team. And your medical assistant is helping the physician and the physician's assistant coordinate your care. So again, if you were to email or call or reach out to us in any way, we have a medical assistant who's going to be able to direct those messages to either the PA or myself or the other physicians as well. And so you have a whole team looking at you, not only from a prescription and protocol perspective, but also just from implementation, meaning just, something's wrong with your pharmacy, you're not sure about what labs we're supposed to order. The MA is going to get back to you and coordinate that with you so that you're not left hanging. Again, our goal is to take the best care of you as possible. We have tried to put the people and the tools in place so that we can do that, and we want to ultimately give you as much control over this as is possible. We have a wonderful person in the front of our office who's going to greet you and treat you with respect every time, is going to coordinate the paperwork that's necessary, unfortunately, in order for us to take care of you. Our office is completely paperless now. I'm very happy to say that, so that we can not only be efficient, but have an appropriate record of all of the documentation for you to refer to at any time. So when you come to our office, you're going to see that we have a very professional team. We have a beautiful office that's comfortable and as non-medical as possible. We do a lot of things at this office. So we're functional medicine, anti-aging, and regenerative medicine specialists, as well as sexual medicine specialists. We do hair regrowth procedures that are very cutting edge with stem cell therapy, platelet-rich plasma, as well as functional medicine approach. We do aesthetic medicine. I'm an aesthetic artist, and we train other physicians here at this facility to do the sexual wellness procedures as well as aesthetic procedures. I've been doing Botox and dermal fillers and laser work and chemical peels and professional skincare now for years, and I love doing it. It's a lot of fun. So as you look your best, or as you rather feel your best, we can help you look your best as well. Sexual function is a very, very important aspect of being a human being, and so we really want to make sure that you are having the best experience possible, and that we can support your physiology in many, many ways to help increase your potential function. So lots of things that we do here at the office. It's hard to explain what we do because we're addressing your entire body. So from head to toe, we are asking you to fill out very detailed questionnaires, and that's so we can understand better what systems might be out of balance. There's lots of great testing that we can also do, and don't be scared that this specialty testing is ultra expensive. Oftentimes your insurance will pay for it. The expense of this type of care is really upfront, is getting to know you and getting you started on some protocols. Our patients get better very quickly, and we're able to then maintain good health and certainly engage to any degree that you're interested in. For instance, there's genetic testing that's now very, very accessible to everybody, and we're learning more and more about what to do with that information. We can advise you. We can take a look at your family history, which will identify your weak link, if you will, your wellness weak link. And even though we get you feeling terrific, we can still look into what your potential risks are and how to help you stay well. That's the key. Most of our patients come to us not feeling well at all, and they've been to many, many places. And our functional approach is what allows us to help them get better very quickly. Our understanding of the underlying cause of some of these problems and our desire to help balance and restore balance so that there is wellness. Wellness is not simply the absence of disease. Most of our patients come to us and they're not technically diseased. If they were diseased, at least their physician would be able to look up the recipe for some treatment with medications. Most of our patients are not diseased, but they don't feel well. And that's because they're on their way to disease. There's an imbalance that occurs. Disease is a dis-ease, an imbalance of one system or another, and of course they all work together. So it's important that you look at the body as a whole. The other thing is, again, the wellness is not simply an absence of disease. It's really the presence of a vitality, a wellness, a well-being, a sense of health and energy and vibrance. And that is what we do here. That's what we strive to help you create, and sometimes for the first time in your life. Often people will come with bowel issues. Oh, I've been constipated even since I was a kid, or I've always had that problem. Doesn't mean that it's okay. Just because you came into this world with that problem doesn't mean that it's not an imbalance. Oftentimes mothers, while they're pregnant, will get antibiotics for various things, or will come into contact with toxins or various substances that may cause the baby in utero to actually start life with some of these imbalances. So it's really fun to help people get better, and we have put together a fabulous team to support your wellness right from start to finish. We're very open to any feedback that you might give us to help us improve patient care. That's ultimately our goal. Our mission is to have the best patient experience and best patient outcomes. So we're here to help you and we hope that you join our practice. I'm going to make a video, or rather the next video that you can watch that is on this letter is about your personal health record, and that's the patient portal. We're going to refer to that many times. We communicate with you from this office through the patient portal. So when you start your engagement with Body Logic, you will get various emails from various places, and lots of times they'll look like they're from me, and it's my support team that is helping to get you what you need. But the way that you communicate directly to this office, to the physicians, the physician assistants, the MAs, the front of the office, the way you communicate with us is through the patient portal. Simple and easy, it's protected, it's secure, you're able to have access to your health information as well as access to this team that's here to take care of you. You can request refills. I'm going to show it to you. I get excited about it because it's to me, it's really just another way that we can work together to take the best care of you. So, hope to see you in the office. Take care.